Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about the different signs that we see in complications of otitis media. So the signs that we will be talking about today are the delta sign. We'll know what is the Griesinger sign, Kernig sign, Brudzinski sign, ironed out appearance of the mastoid, Lighthouse sign, Reservoir sign, and the ring sign. So we'll be discussing 8 of these signs. These are all signs that we see in complications developing in otitis media. You can also now purchase my notes. I have added links in the description. Okay, so let's get started with our first sign. So over here, what we see here is the delta sign. Now, what is delta sign? First of all, delta sign is a radiological sign. As you can see over here, we usually see it in a contrast enhanced CT or an MRI scan. What is this sign? So if you look at the image over here where the arrow is pointed, we can see that there is a triangular filling defect over here within the dural venous sinus. And this triangular defect is surrounded by a contrast enhancement, which is basically, if we had to talk in radiological terms, we are seeing a central low density with rim enhancement. So this is what delta sign is. Now delta sign has another name to it, and this is also known as empty triangle sign. Why so? Because as you can see over here, this looks like an empty triangle. That's why this is also known as empty triangle sign. Now this is delta sign is a common feature that we see in lateral sinus thrombosis or sigmoid sinus thrombosis, which develops as a complication of otitis media. Now, what happens here exactly? Why do we see this sign? So, in a contrast enhanced scan, what happens is when the venous sinus is thrombosed, it is not able to fill up with the contrast. So, we are seeing an empty triangular area where the contrast has not filled up. However, the surrounding dura starts enhancing how it should normally be doing. That is why we end up with this central non-enhancing triangular area, which is the thrombus area, and it is surrounded by an enhancing dura, which is giving this triangular rim enhancement. Therefore, this is known as delta sign or the empty triangle sign. Now, another question that you may be asked over here is, which cut will show you the delta sign? So this is usually seen in an axial cut in the posterior cranial fossa. Now, some high yield questions that can be associated with this is, so we know that this is found as lateral sinus thrombosis. Can you tell me what is the most common ENT cause of lateral sinus thrombosis? That will be CSOM with cholesteatoma. And can you tell me another sign that you can see, another clinical sign that you see in case of lateral sinus thrombosis? This is bringing us to the next sign, which is the Griesinger sign. Now, Griesinger sign is also a sign that we see in lateral sinus thrombosis. So, what is Griesinger sign? So, first of all, this is a clinical sign which is elicited during the time of mastoid examination. What we see here is we see that there is an edema of the post-auricular soft tissues. You can see this region over here. This is a post-auricular soft tissue area which is overlying the mastoid process. So Griesinger sign is the edema of the post-auricular soft tissues overlying the mastoid process, and this possibly occurs because of thrombosis of a particular vein. Can you tell me which vein is this? This is the mastoid emissary vein. So thrombosis of the mastoid emissary vein leads to edema of the post-auricular soft tissues which overlies the mastoid process. And this is what Griesinger's sign is. So why does this happen? So when there's infection in the mastoid air cells, the infection starts spreading from there and it leads to the thrombosis of this vein. And once there is thrombosis of this vein, it impedes the venous drainage. Now, because there is impediment of the venous drainage, it leads to venous congestion and edema over the mastoid region, and that leads to the development of the Griesinger sign. Now, this sign is basically an eponym, meaning this was named after Griesinger, who was the one to describe this mastoid region edema because of mastoid emissary vein thrombosis, which is seen in lateral sinus thrombosis. So, this is what Griesinger's sign is. Coming to our next sign, we have the ring sign. Now, what is ring sign? So, first of all, this is a radiological sign. We usually see it in a contrast enhanced CT or MRI of the brain. What do we see here? If you look at the image over here, if we had to describe it, we are seeing a ring enhancing lesion where a central necrotic or hypodense area, this is the central necrotic hypodense area, is surrounded by an enhancing capsule all around. That is what ring enhancing sign or ring sign is. Where do we see this? Ring sign is typically seen in case of brain abscess, which can develop as a complication of otitis media. So how does this happen exactly? So the central hypodense area that you are seeing over here, this core is the area which contains the pus or the necrosed area. And this peripheral and ring enhancing appearance that you are seeing, this is formed by the capsule of the brain abscess. And around that area, if you see in this area over here, there is some edema surrounding this lesion. That is the surrounding edema of the brain abscess. Therefore, this is what ends up forming the ring enhancing lesion with edema. Now, so let me ask you some common MCQ questions that you may be asked regarding this. So, first of all, what is the most common cause of brain abscess? Or rather, most common ENT cause of brain abscess? That would be again CSOM with cholesteatoma. Next, can you tell me what is the most common site of otogenic brain abscess? So we have two sites that we commonly see it in. One is the temporal lobe and the cerebellum. But the most common one is temporal lobe, and the second most common site is the cerebellum. And another question that you could possibly be asked over here is, can you tell me the most common intracranial complication of CSOM? So we know that we have multiple intracranial complications like subdural abscess, extradural abscess, meningitis, brain abscess, lateral sinus thrombophlebitis. But can you tell me which is the most common intracranial complication of CSM? That would be meningitis. Okay. And one last question regarding this is, so just because you see a ring sign on a contrast enhanced CT or MRI, you should not be jumping to the conclusion that this is only a brain abscess, because this has multiple differential diagnoses. Whenever you see a ring enhancing lesion, yes, definitely it can be a brain abscess, but some other common differential diagnosis could be, it could also be from a metastasis or a glioblastoma or a tuberculoma or neurocystic sarcosis. So these are all possible differential diagnoses of the ring sign. So therefore, when you see a ring sign, do not jump directly into the diagnosis of brain abscess. There could be multiple different causes related to this. Okay, moving on, we'll move on to our next sign. And our next sign is the Kernig sign. Now, what is Kernig sign? So we all know, we have done this bedside. We have learned it right from our MBBS days. This is a clinical sign. How do we elicit it? So what we do here is, when the hip of the patient is flexed, and then with the hip flex, the knee is extended. So the hip is in flexion over here, and then now you're extending the knee. Knee extension, what it does is, it ends up stretching the sciatic nerve and the inflamed meninges. This will result in a lot of pain as well as spasm, and preventing a full knee extension. So normally in a normal patient, when you extend the knee like this, you will be able to extend it completely. But in case of positive Kernig sign, what the patient will tell you is they will have pain in the lower back, or they can have resistance towards extension of the knee, or they will have complete inability to extend the knee. So any of this happens, that becomes a positive Kernig sign. In a normal patient, you should be able to completely extend the knee. So this is a clinical sign of meningeal irritation. We have one more sign of meningeal irritation, and that is the Brudzinski sign, which we'll talk about next. So, Kernig sign is basically a clinical sign of meningeal irritation where there is pain or resistance occurring on extending the knee when the hip is flexed. And this, as you can guess already, is seen in meningitis. And meningitis is the most common intracranial complication that we see in case of CSOM. Now, Kernig sign is also an eponym because it was named after Vladimir Kernig, who was the one to describe this sign in patients with meningitis. So, if we had to remember it an easy way, I have a mnemonic for you, KE. So, KE from Kernig sign. So, KE is Kernig sign, meaning knee, K for knee, and E for extension. That means KE, knee extension is painful. So this is an easy mnemonic that you can use to remember what Kernig's sign is. One MCQ question in relation to this would be, can you tell me what are the CSF findings that you'll be seeing in case of bacterial meningitis? So the typical CSF finding that we'll have is, we'll see an increase in the neutrophil content, increase in the protein content of CSF, and a decrease in the glucose content. This is what is seen in case of bacterial meningitis. So that's about the Kernig sign. Moving on to our next sign of meningeal irritation, which is Brudzinski sign. So Brudzinski sign is also a clinical sign of meningeal irritation. Now, what happens here? So, how are we going to elicit this? First of all, make the patient lie down in a supine position. Then, the examiner will gently flex the neck forward. As you do this, a positive Brudzinski sign would be when on flexing the neck, there will be involuntary hip and knee flexion. That is what positive Brudzinski sign is. What happens here? What is the reason behind this? In case of a meningitis patient, the meninges are inflamed, they are irritated. So when you do flexion of the neck, what it ends up doing is it ends up stretching up the meninges. So to reduce the stretch and the pain, the patient will reflexly end up flexing the hip as well as the knee. And this will indicate that there is meningeal irritation in this patient. So this sign is also again an eponym which was named after the Polish pediatrician Joseph Brudzinski, who was the first one to describe this sign. So as we had a mnemonic in Kernig sign where KE from Kernig sign meant knee extension is painful. We have another mnemonic in Brudzinski sign which is, just remember B from here. So B for when you bend the neck, and B for on bending the neck, both hip and knee is flexed. So this is what Brudzinski's sign is. So these were the two signs of meningeal irritation that you see in meningitis. Next, moving on, we have the ironed out appearance of the mastoid. Now, this is also a clinical sign that we see when we are examining the mastoid region. What is this? If we had to describe this sign, ironed out mastoid refers to the smooth and shiny. If you look over here, there's a smooth and shiny flattened appearance of the skin over the mastoid region. So it looks like as if the mastoid area has been ironed flat because the normal bony contour has been lost. So normally, if you touch your own mastoid, if you touch behind the ear, you will be feeling that it is quite irregular. It does not feel like a smooth area. But what happens in case of acute mastoiditis? So acute mastoiditis is where we see the ironed out appearance of the mastoid. So what happens in acute mastoiditis is the infection, it spreads from the middle ear to the mastoid cells. And then once it breaks through the cortex of the mastoid, it causes periostitis along with subperiosteal pus collection. So now because of periostitis and subperiosteal pus collection, eventually it leads to a thickened periosteum. And because of this, the skin over the mastoid becomes stretched, shiny, and swollen up. This leads to the ironed out appearance. It's almost as if, like, if we took an iron instead of ironing the clothes, if you were to iron out the mastoid, this is what it would end up looking like. Although you should not be trying that at home. Yeah, so that's what ironed out mastoid is like, and that is the reason behind formation of this appearance in case of acute mastoiditis. Now, because of this post-auricular swelling is destroying the normal mastoid appearance, this is why it is named as the ironed out appearance, similar to how a cloth looks like. Can you tell me some other signs that we see in acute mastoiditis? So, first of all, we have obliteration of the retroauricular sulcus. So, as you can see over here, this is the retroauricular sulcus, but you can see how this is not defined. There is an obliteration of the retroauricular sulcus. We have the ironed out appearance. Then we have two more signs which I'll discuss right after this which is the reservoir sign and the lighthouse sign. And another one that you see on performing otoscopic examination, which is posterior superior meatal wall sagging. So these are all the different signs that you may see in acute mastoiditis. Moving on to our next sign, which is the lighthouse sign. Now, what is lighthouse sign? Lighthouse sign is a clinical otoscopic sign which we see during the time of ear examination by otoscopy. What happens here? So, when you're trying to see through the otoscope, you will be seeing that there is pus coming out under pressure through a small pinhole perforation, and this is synchronizing with every arterial pulse. This, which is the reason why lighthouse sign is also known as pulsatile otorrhea. What is the condition that we see this in? We see lighthouse sign in a case of ASOM as well as acute mastoiditis. Now, in case of ASOM, can you tell me the stage at which we see it in? So, we know that there are 5 stages of acute suppurative otitis media. I have a separate video on this where you can check it out more to know about the different stages in ASOM. Now, in ASOM, at the end of the stage of suppuration, when there has been the massive pus collection in the middle ear, and it is moving towards early resolution, when the pus breaks out through if this is a tympanic membrane, it breaks out through a small pinhole perforation and enters, hence we enter from a stage of suppuration to a stage of early resolution. When this pinhole perforation develops, this is when we see lighthouse sign in acute suppurative otitis media. So now that there is a small perforation over here, all the pus that is present in the middle ear and the mastoid, it starts coming out under pressure from this small pinhole perforation. And this discharge that is coming out, as you're seeing on otoscope, it kind of appears to be pulsatile because of the transmitted vascular pulsations from the middle ear. So during otoscopy, the pulsating discharge is kind of seen to be reflecting the light. As you focus your otoscope onto the tympanic membrane, it is seen to be that this pulsatile discharge coming out of the pinhole perforation is reflecting the light intermittently. And that is why it came to be known as the lighthouse sign. As we all know, we have seen in all these old movies, horror movies, that these lighthouses on islands out there, what we see is the lighthouse beam, it flashes intermittently, right? So that is what it resembles over here. This pulsatile discharge that is coming out from the pinhole perforation is also reflecting the light intermittently. It is looking pulsatile, like intermittent flashing of the light happening. That is why it has been come to be known as lighthouse sign. One MCQ question over here is, can you tell me what sign you would see in case of a ASOM case where there is a stage of pre-suppuration? So we know that in a stage of suppuration, we are seeing the lighthouse sign. In a stage of pre-suppuration, there is a particular appearance of the tympanic membrane that we see that is known as the cartwheel appearance of the tympanic membrane, where we see, just like a cartwheel, there is a leash of blood vessels running all around, going radially all around the tympanic membrane. Next, moving on to our next sign, we have the reservoir sign, which is going to be the last sign that we discussed today. So reservoir sign is a clinical sign, again, which we see during the time of otoscopy. What is it exactly? So when you try to suction off the pus that is there in the ear canal, so you're trying to suction off all the pus, you'll see that within minutes of suctioning off and clearing of the ear canal, it starts to get filled with pus or discharge yet again. And this rapid reappearance indicates that there is a continuous pus production happening inside the mastoid or the middle ear, which is why the moment you clear it, the pus from the middle ear and the mastoid starts draining into the external auditory canal again. And this sign is a typical feature of acute mastoiditis, where a lot of pus production is happening in the mastoid air cells and the middle ear cleft. This has been called the reservoir sign because the mastoid or the middle ear, it acts as a reservoir of pus. So every time you clean the EAC of all the pus and the discharge, it fills it up rapidly again. So because it is acting as a mastoid is acting as a reservoir over here, this has been known as reservoir sign. So that's all about the signs that we had to talk about today, the different signs that we see in the different complications of otitis media. If you have any doubts regarding this, you can always ask me in the comment section and I'll get back to you. Thank you.